Hey everybody, it's so nice to see you again. Uh, Today I'd like to talk a little bit about medication-assisted treatment. So, medication-assisted treatment is a term that's become more and more popular over the last few years, especially in response to the opioid epidemic. And people often think, like, why would I take a medication to help me with addiction? The whole point of getting sober is to free myself of chemicals. And that is one way to look at it. But one of the reasons I went from becoming a substance counselor to a doctor is because I was working with a lot of people who, despite making meetings, living in sober residential facilities, connecting with their sponsor, feeling internally like all they wanted was sobriety, I watched folks relapse over and over again. And I went to medical school really to study addiction because for me and for many of us in this field, we see addiction not as something that is chosen or is about bad behavior or habits, but more a neurological disease, something that affects the brain. And what we know about chronic diseases like addiction is when we couple things like medication alongside behavior change, that's when we see the best results. So medication-assisted treatment is really an acknowledgement of how much folks who struggle with addiction can get healthier by using medications to support their brains in either not craving substances or having a adverse response so that they don't use substances while they're taking it, or even to help them avoid cravings or withdrawal symptoms by taking medication. And in the same way that we don't tell diabetics, okay, you should either diet and exercise or you're failing your diabetes. The same is true for me, at least, in terms of addiction, that if you struggle with a substance use disorder and you take a medication as prescribed, that doesn't mean that you're replacing one addiction with another. In fact, the way we define addiction is really not just based on whether or not you need to take a substance, but if you're doing things despite negative consequences, if you're using more and more, if people in your life are voicing concern, if you're not making things at work or in terms of your legal status, jeopardizing yourself in some type of way, that's addiction. That's in its kind of totality of definition. It's not just about physical dependence. So taking a medication to assist in your treatment is one way to support your brain in helping you to do all the things that you need to do to lead a healthy life. Go to work, be a good family member, be a good partner, be a good community member, be a good citizen, not violate the law. So medication-assisted treatment speaks to the fact that despite doing certain behavior changes, like removing yourself from people, places, and things, and going to meetings and getting support around your sobriety, that people still continue to use. And so it's the acknowledgement of that, and it's the coupling of medication with other behavioral strategies to really promote people to have a healthier lifestyle and to minimize the consequences of their disease. When someone is on medication-assisted treatment, it shouldn't be standalone either, just in the same way that people with diabetes should not just take insulin alone, but should also try to eat right and exercise. The same is true for addiction treatment. So it's not just about taking a pill or a medication and not working on other aspects of improving yourself mentally, spiritually, physically, alongside maybe using a medication to really get the best outcomes. And when we look at the scientific data, we see that those people who get medications and use medications to support their substance use disorders are really the folks who tend to do the best. So in the next few videos, we'll talk about specific use disorders like opioid use disorders and alcohol use disorders and the medications that we use to treat those. Until then, be well.